Paul George suffered a knee injury during this preseason game against the Hawks, and honestly, it's not really getting much attention online, but could in fact turn out to be something quite serious for the 76ers' new player. Welcome back, everybody. I'm Dr. Brian Sutterer, and the goal in this channel is to teach you about the medical side of the sports world. So, taking a look here, Paul George, on the broadcast, they didn't even say anything about it. I went back and watched through. There was no mention of Paul George leaving the game after this happened. We just saw he wasn't returning for the second half. There was no other replay, but this could turn out to be a pretty serious injury. George did not return. The official word is just a knee hyperextension, which, remember, hyperextension is not a diagnosis. It's just a description of what the joint does. You can hyperextend any joint. You can hyperextend your wrist, your elbow, your fingers, here in this case, the knee, but that doesn't actually tell us what the injuries are. And some hyperextension injuries can result in ACL tears or PCL tears, injuries that could keep you out for the season. Here's what we're seeing with Paul George. So this happens as a result of this unexpected movement, right? Whenever your limb goes into an unnatural hyperextended position, it's because of some unnatural position, some fall, somebody lands into you that pushes your knee into that different way. Here, as he's going defense and backpedaling, he puts that left leg out and he's really paying attention down here to the ball. And so he kind of loses track of where his left leg is in space. And you can see how that knee just pretty severely hyperextends on him here. So this position is going to be about neutral in terms of the alignment, the position of the knee. And then as his momentum carries him backwards, his foot is anchored into the ground. That momentum continues and we see that amount of hyperextension. We're not really catching him straight on, and so it's hard to say the exact angle, but what we're talking about is going to be if you draw a straight line out here and then a line coming down the tibia, this angle right there is going to be the degrees of hyperextension. The other important factor with a hyperextension injury is also the side-to-side movement of the limb, because that's going to put a lot more stress on the collateral ligaments like the LCL, the MCL. We all saw recently with Rashee Rice, of course, in the NFL. He suffered an LCL tear on the outer part of his knee because there was more of this varus load pushing the knee from in to out. We don't have any external load here with Paul George. Typically, that's a good sign. Usually when there's no external load causing the hyperextension, it turns out to be a less serious injury, but there's a lot of stuff that can happen here. So if we go and we look at our biodigital anatomy tool next, the first structure of interest is going to be this joint capsule. The capsule surrounds the entire joint. It's like the lining, the protective lining around the joint to maintain that joint space. And so if the knee hyperextends, you're going to get tearing, stretching of that capsule. And that's not anything that needs to be surgically fixed or repaired, but can certainly cause a lot of pain. The next thing then, if you hide the capsule, what you're going to have happen is you're going to have bone contusions. So contusions is essentially a bruise. Whenever the knee hyperextends, you get a compressive force pushing down that way, while you have tension on the back side of the knee. And so in the front of the knee, as it knocks and hyperextends, it's very expected. You can assume that there's going to be bruising, there's going to be some microfracture in the front of that bone. That can also injure the cartilage in the front of the bone. You can also have meniscal tears. On the back side of the knee, the next structure that's going to get torn in that excessive tension or stretch is this oblique popliteal ligament. Again, not really a named ligament that we think of looking at on like ultrasound or MRI, but is very frequently injured with a hyperextension. Next, you get into those deep, key, important ligaments inside the knee. We're talking about the ACL and the PCL. Both can occur whenever there's been a hyperextension. PCL sits in the back side of the knee, and if you imagine, right, you take that anchor here, you take the anchor point up there, and you just stretch, extend that knee further. You're stretching, you're putting tension on that PCL, potentially tearing the PCL. Same story with the ACL, just running in the opposite direction. Now, I'd like to refer back to this injury with Giannis because hyperextensions are one of the hardest injuries to just look at on a replay and judge the severity of, because we all saw this with Giannis Antetokounmpo during the playoffs, I think a few years ago, and he only missed like 2 weeks. So you see the severity of hyperextension here, the amount of extension there is just crazy, and only missed a couple of weeks. So something that looks that bad didn't turn out to be anything like an ACL or a PCL, but there's other examples where it doesn't look as bad, but the right amount of twist, the right amount of torque in that knee as well can lead to an ACL or a PCL. So if we look back here through this play for Paul George one more time, he lands, the knee is initially here in a neutral position. As he goes into that hyperextension, the front part of the knee is going to contuse and bump together. The back side of the knee is going to be stretched, and depending on the rotational forces, the in and out forces through the joint. Also, potentially something like an ACL or a PCL. Absolutely, George is going to have an MRI here, and they probably have a pretty good sense right away in terms of anything like an ACL or a PCL tear. Certainly those would have him out for the season unless they're partial injuries. So expect more to come on Paul George. Again, wild that this isn't really receiving any more attention, because this very well could have the potential to be a season-altering injury, or, like we saw in the case of Giannis, something that just causes him to miss a couple of weeks. Again, hyperextensions are very hard to predict, but if you think of that underlying anatomy, what gets stretched, what gets pulled, what gets bumped together, at least a bone bruise, at least a capsule strain, and then really you're just crossing your fingers and hoping that there's nothing else deeper inside. That's it for the video, everybody. Thank you as always for watching, and I'll see you in the next one.